morning to all of you. Good day wherever you are and wherever you are listening to this lecture. I hope that, please give me some feedback that you see the first slide. Is it okay, Andy?
Yes, yes.
Great. So we are going to speak today about something that actually converges diplomacy and medicine. And I call it International Medical Teaching, Guidance and Collaboration, Bridging the Global Health situation and gap. Now, in short, I am going to speak to you today about the global and Israeli health situation, about the Shiba Hospital and the Division of Obstetrics and Gynecology, and the projects that we at the Obstetrics and Gynecology Department and at Shiba International are doing around the world. In 2006, Tom Friedman, the known New York Times correspondent and writer, published a book that was called The World is Flat, and he meant actually the changes that are going to occur because of electronics and internet. But 15 years later, we have questioned, is it really flat? Is the world really flat as he projected? I can tell you that the medical world is definitely not flat. Today, your health and your length of life depend very much on geography. Where you are born makes a big difference. Where you live makes a big difference to your health and to your future. Just a graph that maybe many of you know. This is the life expectancy at birth by sex of many countries. There is a huge difference between the best country and the worst country, more than 30 years. You can see here that the OECD had a mean of 80 years. And actually, fortunately for us in Israel, we are at the top, but many countries, some countries even our neighbors, and some countries that you would expect them to have good results are not there yet, I would say. And if you think about the connection between health and mortality regarding women's health, and I said to you already that there is a 30-year difference between the top and the bottom countries. There is a large difference in maternal, neonatal, and under 5 years mortality and morbidity around the world. Maternal mortality defined as how many women die after birth out of 100,000 live births per year. It ranges from 1,000 in the worst countries to 3 to 5 in the best countries. And you'll be surprised to hear that even in the European region, the mean is 21. The developing countries account for 99% of annual maternal deaths in the world. And the decline, of course, is in the African regions, but not only. Also, our neighbors are in the slowest, are with the worst numbers. Another point, about 16 million girls aged 15 to 19 years give birth every year around the world. This makes about 11% of all births worldwide. And it's not just the little girls who deliver, it should be enough, but the children who are born and their life expectancy and their morbidity is also, of course, affected. Europe has estimated that losses linked to health inequalities in Europe cost around 1.4% of the GDP within the European Union, almost as high as the EU's defense spend. And the most important point in this slide, this is not due to biological or genetic reasons. It's important and also it's optimistic because it can be changed. And now you might ask, why should I be interested in the health inequities in other countries? Because beyond the increased rate of local diseases and deaths, these inequities affect social and societal integrity, dissatisfaction, they cause unrest, even revolutions and wars. And we spoke already about the lost economic resources that are lost and cannot be used for other reasons. Just the last year, with the recent epidemic, demonstrated also the global effect and impact of health inequities, with many countries having suffered quite a lot, others much less. Let's look at Israel. Israel is in the fortunate situation of an increasing life expectancy. You can see here, and many people are surprised about that, when the country was erected in 1948, the life expectancy was around 66, 67 years. Today, the life expectancy in Israel is 83 and is projected to increase. Part of the changes are due to obstetrics and gynecology. If you look here at the neonatal mortality rate, defined as the death of infants within 28 days of birth, you can see that in the 70s, we were around 13, 14 per 1,000 live births. Today, we are at 1.9, an immense decrease in numbers, which again gives you an optimistic view that you can achieve it even if you are at high numbers. And if you compare it to some countries, and I chose countries where I'm active, and these are relatively good numbers, you can see that Israel with 1.9 is still twice as good as the US, as the United Emirates, as China, and probably tenfold better than some of our neighbors and many countries around the world. In maternal mortality, the changes in Israel were even more significant. If you look at this number, we are number 5 in the world concerning maternal deaths per 100,000 live birth. And this has happened over the last 20 years. 20 years ago, we were at 7, and you see a gradual decline towards better and better numbers. And this occurs despite 2 factors. One, you have a high fertility and delivery rate in Israel, much higher than the other countries that I showed you here on the top. In addition to that, unfortunately, we know that in Israel, the health expenditure is not quite high, and it's much less than in other countries. So I'm doing it not to brag about Israel. I'm showing it to you in order to show you that changes can be done, and changes in health management and health in clinical health can make quite a lot of difference. Let's speak about the Shiba Medical Center. Some of you heard, I'm sure, Professor Zilmichman last time. The Shiba Medical Center is regarded as the national hospital of the state of Israel. It's probably one of the biggest hospitals in the world outside of China, with numbers that you can see here, more than 1,700 doctors, more than 1.6 million clinical visits per year. It's a huge hospital. But despite, or maybe because it's such a big hospital, it has been recognized around the world as a leading hospital, both by the JCI, which is the joint commission that examines hospitals around the world, both by Newsweek. 3 years in a row, we are regarded as one of the 10 best hospitals in the world. And remember, probably the biggest one of the list. And also locally, most good doctors in Israel, most those that are recommended, work at the Shiba Medical Center. We, at the Division of Obstetrics and Gynecology, are very proud of working in this hospital, but we are very proud of our division too. We regard ourselves as one of the main rocks of this hospital. And as you can see, we have leading tertiary centers in many, many fields of obstetrics and gynecology. We have a very prolific fetal-maternal medicine unit. We do diagnostic and invasive ultrasound, as well as MRI. Fetal therapy. We treat fetuses inside the womb during pregnancy surgically. We have a gynecological microsurgery unit with robots. We have a leading reproduction IVF center, oncogynecology, prenatal genetic evaluation. We have a very basic research laboratories. And yes, we have joined the ARC Center, the Health Innovation Center of Sheba, and have our own innovation center where we connect to Israeli biotechs, startups, and we develop the next generation of treatment. All this is being done by 120 physicians, a huge number for just this division. We have 21 professors. Many of us give lectures around the world. We publish 50 medical articles per year. Imagine every week we publish another article while we work quite hard. We deliver between 990 and 970 deliveries per month, and we have a lot of clinical activities. So why do I speak to you about bridging the international health gap? Because I showed you that Israel has a very good, efficient, and successful health system. The Shiva Medical Center is a leading hospital with multiple comprehensive services, and this is also important, and educational facilities. We have leading teams with international clinical and educational background and exposure. As I said, we at Vision are in a unique position to guide and collaborate with other countries and hospitals, as I'll show you. So let's speak a little bit about one department of the Shiva Medical Center, Shiba International. It stands basically on 4 major feet. And the 2 major feet that I'm going to talk to you about are providing consultancy services and training programs for medical personnel, as well as for public institutions and governments, as well as private companies around the world. How do we do it? We have several programs. One is at Shiba. We have groups of foreign medical personnel coming to us to Shiba for days, weeks, sometimes months, and they receive here lectures, clinical exposure, and hands-on training. We have the big possibility of MSR, and I'll talk to you about it. It's the Medical Simulation Center that is leading at Shiba. And by the way, a very important point in diplomacy, and as well as for us Israelis, these visitors travel in Israel, learn about Israel, and learn to appreciate the country. Another possibility is at the customer's hospital and country. We travel abroad and we collaborate in different countries with our associates, and I'll show you about that. Shiba is leading the field of telemedicine, telelaboratory. We have a unit that is called Shiba Beyond, which is the basis of the virtual hospital of the future. So part of our activities are being done by telemedicine and by conferences and patient guidance over telemedicine. And as I said before, managerial consultancy is very, very important, because you don't need just good doctors. You need a good managerial service that has been developed in this country. And for example, the success of the vaccinations, the success of medicine in Israel is not just due to clinical medicine, but also to managerial possibilities. So how do we do the customer side procedures? First of all, when customers come to us, mostly universities and hospitals, we evaluate their needs. What do you want to achieve? Where do you want to be in 3, in 5 years? Then 1 or 2 of us travel to this site and do a procedure that we call gap analysis. We try to judge the gap by traveling there and evaluating the current situation and desired future outcome. Once we come back, we write quite a thick a protocol and book about what we saw, what we think that is present, what the strengths and weaknesses are, and what future changes need to be achieved in order to arrive at the desired outcome. And then both sides agree on a work plan and milestones. Duration, frequency of Shiba experts on site visits, visits of foreign medical teams at Shiba. They come to us in order to get the idea where we want them to be and how we want to collaborate with them. And as I said, telemedicine and on-site procedures. Every organized visit to the site is being followed by a report on the achieved goals, on existing gaps, future visits. We always put a higher standard that we want to achieve during the next time. One of the aims of this collaboration, and I call it all the time collaboration, we are not coming to teach the less knowledgeable. No, we are collaborating. And by the way, this is a true word, because I can tell you that I myself learned quite a lot from these travels, from these collaborations, things that I then employed with us. And it includes, by the way, common research projects and publications. If you don't write about it, you don't teach others, you are not on the plan. And a very important point to our the other side is we engage, if necessary, in PR activities if requested. Let me speak about the Medical Simulation Center in Shiba, which is very important for this undertaking. We were the first virtual hospital that enhances the quality and safety of patient care. About 17,000 healthcare professionals are trained here every year, from resuscitation to management of difficult cases. Our residents, our physicians undergo training there. And it's not surprising that it was erected by previous pilots who said, wait a minute, we need simulation for flying an aircraft. Why don't we need simulation for something that is at least as important for medicine? So we have virtual reality, role playing, and so on and so forth being used. And as I said, the Shiba Beyond, that is triggering and targeting long-term internet and electronic surveillance of patients. And we use it also recently. Shiba Beyond signed with one of the countries an agreement where our physicians treat the patients there together with the local patients from the farm. So what OBGYN international projects did we do? And let me tell you about some of them. One, which is which was a very successful one, was a neonatal and perinatal project. The customer was UNICEF. They saw the problems in Georgia, and they asked us to improve the neonatal and perinatal fields in Georgia. And the plan was to reduce maternal, perinatal, and infant mortality rates in Georgia. And I can tell you it was headed both by gynecologists and by pediatricians. And this is, for example, the publication by the WHO that showed very, very significant changes in infant death rates, in maternal death rates, as well as in population growth in Georgia. This is regarded as a very successful project with a lot of echo around the world. This is a project where we were approached by a new hospital in Weifang, a small Chinese city of more than 10 million people. They opened a new hospital supported by the Sunshine Insurance Group, and they approached us because they wanted to help them introduce top quality and efficient health services to the OBGYN department. We wanted to implement it in a single department, and actually this was a very successful project. I led it. I visited over the 3 years period nearly 10 times the site, but not just me, about 15 physicians and medical personnel of our department was traveling there. We spent there a week or two, and we improved their medical outcome. And I can tell you that we succeeded also statistically. Not only did we improve the outcome of the patients, for example, we reduced Chinese suffering from a very high cesarean section rate up to more than 70%. Actually, when we came there, we found a 70% rate of cesarean section for deliveries. Imagine 70 out of 100 women who deliver undergo cesarean section with all the implications. We reduced it within our time period to around 30-35%, which is a huge decrease and made also waves and echoes around China. We introduced new clinical protocols, and we were also part of a PR exposure so that this new Sunshine Hospital, during our collaboration, could grow quite quickly and quite successfully. Here you can see a group of Kazakh physicians and nurses. They approached us because of a wave of maternal death in Kazakhstan. And they approached us, first of all, to evaluate why it happened. And then they sent us this group of physicians. They spent here 3 weeks and left. You see here, these are the pictures on the last day. And we established both improved clinical knowledge, friendships that last until today, and we can say improved medical service to the population that they serve. Here you have physicians from Ghana who came to study microsurgery. You see them here at MSR, at Messer, doing their studies. You see them here with robot surgery, with studies of robot surgery, both things that they didn't know before, and they left, of course, with increased knowledge in microsurgery. This is another Chinese project that we started and unfortunately was curtailed by the COVID epidemic. We were there 1.5 years ago, and you can see the representatives of Jinan. Jinan is a large city very close to Weifang. They heard about the success that we had in Weifang. They came to us and wanted a similar project. We were there, we did a gap analysis, and you can see me here with with a team of reproductive endocrinology. Basically, we tried to establish their collaboration on fetal treatments, on fetal maternal treatments, on reproduction, and on pediatrics, because we thought that it's a part of a similar tree with similar roots that needs to be done in order to improve this hospital. We are looking forward, maybe now that COVID has subsided all over the world, that this collaboration will continue. Another interesting collaboration that has been started recently is we were invited by the Medcare Women Children Hospital in Dubai to start a collaboration and to improve their medical activities. Dubai, for those of you who know, has also different levels of medical care. Some hospitals are quite top hospitals, some of them less. This hospital has very good medical staff, but still we found out during our stay there that you need to improve managerial activities. You need to improve and adjust protocols. And we are looking forward to the collaboration in fetal therapy, female reproduction, gynecological microsurgery. Actually, we had a very, very good visit. We felt very welcome. And I think personally, this was very successful. And another interesting aspect of this collaboration is that this hospital belongs to an Indian group, a very large Indian group that has several hospitals, both in the UAE as well as in other parts of the globe. The main word is collaboration. And this is what we look at. And in order for our collaboration to be successful, both sides need to be happy. And what I show you here is, first of all, the benefits that we at Shiba think and have already achieved. On one hand, we disseminate information and exchange medical knowledge. We provide adequate and improved medical treatment to our associates and establish groundbreaking international medical research projects. We introduce and promote Israeli modern medical and biotech technologies. They are interested, all our partners are interested to learn about our new technologies that we are employing. And of course, we promote medical tourism. Some of the cases are difficult cases. They need to be treated here in Israel at Shiba, and these cases come to us. And not less important, we establish and improve international Israeli personal and diplomatic connections. We bring opinion leaders to Israel and connect them to our country. We present another positive side of Israel. And last but not least, we establish an additional economic income for the Israeli health system. All these projects are supported and in accordance, of course, with the health ministry. And on the other hand, what are the benefits to our partners? They are being exposed to a leading hospital and a leading OBGYN division. They evaluate their medical and managerial gaps and get propositions for improvements. They receive regular visits of Shiba experts at the partner hospitals and exchange local and adapt their local medical protocols. And of course, they are being introduced to the cutting edge new technologies that we know about and that we introduce to them. They are visiting the Shiba medical centers. They receive lectures, and we also arrange conventions supported by both sides by Shiba experts. And this results in long-term and short-term collaboration. And we, as I showed you, we have data showing us that there is a benefit to the population. There's a benefit in improved medical treatment outcomes. And last but not least, there is improved local branding that results in increased patient flow and reimbursement for our partners on the other side. So what I showed you is the importance of international medical teaching, guidance, and collaboration. I think it's important for all of us to bridge the global health gap, and I hope that I convinced you about this importance. Thank you very much. I did it in all the languages that are probably on the receiving side of this lecture, and this is my contact information if you want to hear more. Thank you very, very much.
Thank you very much, Professor Rabinovici. If there are any questions, maybe we'll take one or two at this point. So if you want to ask a question, you can either type it on the chat or just unmute yourself and ask the question. So if there are no questions, I would like to ask one question, Professor Rabinovici. How does usually the connection is being established? How does it start usually? Does it come from the receiving part? How does it go about?
There are many connections possible. Some are through the foreign ministry and the diplomats who hear that connections can be achieved. And many of these connections are at least supported if sometimes private people come and connect between us. We are presenting Shiba International at different exhibitions, and we are present also on the internet. So there are many channels that are present, and actually we hope that also some of the participants here will be connectors and will connect between these possibilities, both in the countries where they are located and us.